Hi, I'm Swati Khanolkar, and the emotion that I'm going to talk in this video about is depression. Now, depression is a very loosely used word. Almost everyone is claiming to be depressed about almost everything in life, and therefore it becomes very important to understand this word in its true form and distinguish it from this other negative emotion that we feel, which is sadness. So every time that we are sad, is it the same thing as being depressed? Obviously not. What sadness means is that we are thinking that things are bad right now and that I don't like the way things are right now, but when we think depressively, what we are saying is that things are bad right now and they are never going to improve. This certain prediction that things are never going to improve then almost convinces us that therefore what is the point in trying, and that is then what we call learned helplessness. That leads to lack of proactivity because we convince ourselves that no matter what I do, the situation is never going to improve. This place in the mind then eventually, if consistently reinforced, becomes some sort of a comfort zone from which one does not want to risk getting out, and then one will go to any extent to not have to come out of this comfort zone, which is again what leads to passivity or lack of proactivity, which is such a strong symptom of this emotion of depression. And this habit, the mental habit then of escaping from making choices and convincing oneself that there are actually no choices, then almost becomes addictive to the point that people could be scared of this freedom of choices that we have. We tell ourselves that since I'm getting a raw deal, life is being unfair, that I'm getting something that I don't deserve, that life is following a path that I don't want it to, that the script is not being followed and therefore being violated or deviated. And all of these thoughts then sort of make it even easier for us to stay within this comfort zone. Now, largely what we try to deal with this emotion of depression is probably meditation or other feel-good techniques like talking it out with somebody or trying to think positive thoughts or praying. And though all of these techniques seem to work, they work only temporarily because we've still not worked on the thought component or the cognitive component which is inherent in every emotion. And therefore, the effort in therapy, especially rational emotive behavior therapy, is to identify the root of this emotion of depression in the thoughts and then modify it such that we not only feel better but get better. We learn to proactively work on minimizing our emotional disturbances, and we learn to stay committed to making and then keeping ourselves happy.